Statement number 2. Meds are like crutch. It changes you unnaturally. You are no longer the real you anymore. What's up, y'all? It's me, Jaren Lim, your Indonesian mental health advocate. Today, I'm going to continue talking about the facts and the myths about psychiatric medication. In the previous episode, I used non-psychiatric medication as an example. If you haven't watched it, go ahead and watch it to better understand this video. Buat Neurodialecticers yang orang Indo, jangan lupa kalau semua video-video gua itu subtitle-nya tersedia dalam 2 bahasa. Ada bahasa Inggris sama bahasa Indonesia. Jangan lupa dinyalain ya kalau butuh. I always wonder why the stigma towards psychiatric meds are so strong. Hell strong. Say someone has a type 2 diabetes and they take insulin or metformin regularly. Are you going to tell them not to take insulin or metformin because insulin is like a crutch, or that insulin changes them unnaturally, or that they are no longer the real them anymore if they take insulin? As we have already discussed in the previous video, there is no difference between diabetes and psychiatric medications in the sense that both of them have biological basis. Mental illnesses are not less severe than diabetes. If it is okay to take meds for, say, diabetes or your chronic heart failure, why is it not okay to take meds for your mental health? One of the most ignorant paradigms I have always heard is the paradigm about naturality. Many people think that something natural means it's 100% safe, while med or drugs mean it's 100% harmful. I've seen a lot of parents that did not let their kids take psychiatric meds even though their kids were diagnosed with severe psychiatric disorders. They told their kids that drugs are unnatural, drugs have many side effects, don't take meds, everything is just in your head. And they forced their kids to use essential oils and to drink tea every day. I'm going to present you with 2 arguments in this video. Firstly, I'm going to talk about the naturality from the perspective of the drug itself. In order to market a drug, that med needs to undergo a series of clinical trial that usually takes at least 5 to 15 years. It can be faster sometimes in very rare circumstances. For example, we talked about serotonin hypothesis in the previous video. I mentioned that in the late 1960s, evidence began to emerge showing that there is a significant role of serotonin in patients with major depressive disorder or MDD. However, the first SSRI or selective serotonin reuptake inhibitor, fluoxetine, under the trade name Prozac, was not FDA approved until 1987 and was not marketed until 1988. There are at least 5 stages when designing drugs before it can actually be approved and be marketed. The first stage is called the Preclinical Stage. In this stage, scientists explore if and how a med could possibly work. They may use various literatures or prior works or biochemical techniques when designing the drugs. One of the techniques they usually use is the lead modification technique. The first step they usually do is to determine the SAR, or the structure-activity relationship. Structure-activity relationship, or SAR, is an approach designed to find the relationship between chemical structure or structure-related properties and biological activity or target property of the studied compounds. For example, we talked about the stress pathway in the previous video, that is the HPA axis and the cortisol hormone. If you haven't watched it, go ahead and watch it. Cortisol is an endogenous anti-inflammatory agent in our body per se, meaning we actually naturally produce it in our body, and it can function as an immunosuppressant agent, and this is the structure of cortisol. People with autoimmunity, for example, RA or rheumatoid arthritis, has an overreactive immune system that it attacks its own body's tissues. And by the way, many researchers have actually shown that chronic extreme stress can actually cause autoimmunity. In this case, their own cortisol might be insufficient or no longer effective to suppress their own immune systems. In the 1950s, scientists studied the structure-activity relationship of cortisol and immune system, and they used the lead modification technique to design the drug. One of the successful inventions was dexamethasone, a corticosteroid drug. And this is the structure. If you compare between the structures of cortisol and dexamethasone, they're very similar. They're extremely similar. And this is what we call as the lead modification technique. Lead compound or pharmacophore is a chemical compound that has a pharmacological or biological activity, likely to be therapeutically useful, but may nevertheless have an optimal structure that requires modification to fit better to the target structure. In this case, just like cortisol, dexamethasone is a glucocorticoid receptor agonist, but some studies have shown it apparently has 125% intrinsic efficacy on the GR or glucocorticoid receptor compared to cortisol. An agonist is a chemical that binds a receptor and activates the receptor to produce a biological response. A 125 intrinsic efficacy means that it's 25% more effective or efficacious compared to cortisol or our endogenous ligand in our body that is produced naturally in our body. We now have plenty of corticosteroid drugs in the market, and if you compare the structures of these drugs, they're extremely similar, and medications such as antidepressants are no different. They also undergo these intricate processes no less. Structures highlighted in red are the pharmacophore, and you can see that they are extremely similar. Using the same structure-activity relationship approach, they found out that this pharmacophore is effective in modulating some serotonergic and adrenergic pathways. They then used the lead modification technique to invent new drugs. After this design, they will conduct experiments on animals. This process is called the Precritical Trial. If they can show the efficacy of the med using the animal model, they can submit for approval for human testing. And if they are approved for human testing, they will undergo phase 1, phase 2, and phase 3 clinical trials. During these stages, there are at least 3 main objectives that they will observe and explore during these phases. The first one is to explore the dosing. Second one is the effectiveness, and the third one is the safety and the effectiveness compared to the pre-existing drugs. These phases may take thousands and years of study and samples, and only about 1 in 10 proposed drugs can make it through this process. If they have statistically strong evidence and that it can be replicated, they would be able to submit it for review to FDA for approval to confirm the safety and effectiveness. It still takes around 6 months for FDA to intricately review it. Even if a drug is approved, there is still phase 4, and during this phase, this drug is evaluated for the long-term use. If the drugs then produce many side effects or severe side effects, it can be retracted from the market. For example, the first SSRI or selective serotonin reuptake inhibitor is actually not fluoxetine, but it was Zimmelin under the trade name Zilmit in 1982. During 16 months in the market, there were 10 confirmed cases of Guillain-Barré syndromes or GBS. which is a very rare case where your body immune system attacks your own peripheral nervous systems. The estimated occurrence of the hypersensitivity was 3 in 1,000, or statistically speaking, in 1.5% of the population during phase 4 of clinical trials. And guess what? It ended up being retracted from the market in 1983. Drugs are highly regulated. On the other hand, herbal or natural dietary supplements that many people may think as harmless were actually not strictly regulated by the FDA. I'm not saying that all supplements or dietary supplements are harmful, but my point is they did not undergo clinical trials like drugs to determine the safety, effectiveness, dosing, and everything else. One study done by NEJM, or the New England Journal of Medicine, estimated that there were at least 23,000 people end up being in the ER every year, and 2,000 of the cases were severe enough that require hospitalization. Note that these numbers may only be the tip of the iceberg, since many issues went unreported. So, say if you have autoimmunity, severe autoimmunity, and your physician prescribe you corticosteroid, are you going to reject it and prefer supplements or herbal dietary medications because it's more natural? Think about it. Think about the side effects of untreated severe autoimmunity compared to taking meds. Researches and sciences are done for a reason. The treatment guideline used by healthcare professionals are based on scientific researches. If you still believe more in your biases and reject science, I don't know what to tell you. Secondly, I'm going to talk about the naturality from the perspective of our body. We talked about glucocorticoid hypothesis of depression in the previous video. Glucocorticoid hypothesis basically posits that one of the possible causes of depression is due to a persistent increase in glucocorticoid, that is, cortisol. As discussed previously, stress can induce an increase in cortisol, and chronic elevation of cortisol is associated with clinical depression. We used DAMs and puffs in the previous video as an example, but I told you at the end of the video that it is also applicable to human. The graphs here are from human data. We can see here that in many depressed patients, the plasma cortisol level is persistently significantly higher than normal controls or people without psychiatric disorders, and also higher than psychiatric controls, meaning people with psychiatric disorders but not depression. But how is cortisol related to depression? Let's take a step back. At the molecular level, our DNA is packaged around a structure called histone, and this structure is what we call as nucleosome. One of the responsibilities of DNA is to synthesize protein in our body. In this case, DNA is responsible for synthesizing BDNF, or brain-derived neurotrophic factor. This protein is responsible for the survival and the growth of our nervous system. Protein synthesis can be regulated using the epigenetic modification. Let me explain. When our nucleosomes are pretty tight between one another, we call them closed state or heterochromatin. In this state, protein synthesis increases significantly. However, when our nucleosomes are distanced between one another, we call them euchromatin. And in this stage, protein synthesis may increase. On our histone, we have tails, and one of them, we call it HDAC5, or histone deacetylase 5. Acetylation, or the binding of acetyl group designated in A in this picture, causes repulsion between those tails. So nucleosomes are distanced, and these promotes protein synthesis, in this case BDNF synthesis. On the other hand, methylation, or binding of methyl group designated in M in this picture, causes attractions between the tails. So nucleosomes got tightened between one another, and this significantly decreases protein synthesis, in this case BDNF synthesis. Let's go back to our discussion. As discussed previously, stress can induce an increase in cortisol, and chronic elevation of cortisol level is associated with depression. But how? Apparently, an increase in cortisol can cause more methylation on HDAC5 tails. This causes those tails to get tightened. As a result, BDNF synthesis is inhibited. This is called the neurotropic hypothesis. The neurotropic hypothesis suggests that low BDNF level may be responsible for the loss of dendritic branches and spines of nerves in the hippocampus and prefrontal cortex, and for reduced neurogenesis in the hippocampus, which is associated with an increase in vulnerability for depression. As a result, many neuroimaging findings have been consistent. They found out that many people with MDD or major depressive disorder are reduced with hippocampal volume. Other brain regions also show reduction, such as amygdala, ventral striatum, anterior cingulate cortex, orbitofrontal cortex, and prefrontal cortex. A decrease in activity of the orbitofrontal cortex may reflect the decrease in the ability of an individual to control unpleasant thoughts and emotions. A decrease in the activity of the anterior cingulate cortex is associated with a decrease in attention. Some other studies have also shown poor functional connectivity, or FC, in limbic structure. Scientists even call this connectivity as depression circuits. Poor FC in this depression circuit is associated with stress, impulsivity, cognitive dysfunction, and hedonia, and emotion dysregulation. And surprisingly, treatment using antidepressant can actually reverse this effect. Antidepressants may increase norepinephrine and serotonin, thus reversing these phenomena. Through a certain cascadic pathways, these neurotransmitters, norepinephrine and serotonin, can actually increase BDNF. They do not remove the methyl group on HDAC5. However, some studies suggested that they are able to increase acetylation between those tails. So now the closed state, or the heterochromatin, will turn into the open state, or the euchromatin, and BDNF synthesis increases dramatically. As a result, an antidepressant can actually increase the survival and the growth of our nervous system. For example, some studies have actually shown that taking lithium can actually increase the hippocampal volume. So going back to the argument, meds can change you unnaturally. Yes, it does, sure. However, your natural brain volume might be smaller than normal people due to atrophy and decreased survival caused by stress that causes an increase in cortisol, which causes a plunge in the BDNF synthesis, which is eventually detrimental to our health. But taking antidepressant might reverse this. So saying that you are no longer you anymore if you take antidepressant because meds are unnatural is actually foolish. I don't think you are defined by your nervous system. I don't think you're defined by the meds you are taking. I don't think you're defined by your diagnosis. You are defined by who you are holistically as a person. If not taking meds hinder you from being a better person, why would you not take meds? From this video, I really hope that we don't stigmatize people who are on meds. I really hope that if you are struggling with mental disorders, you're willing to seek help, and if you get prescription, I really hope that you are not affected by those stigma towards psychiatric meds. You are who you are, and if you feel like you're always stressed or you are unable to function because of your mental health, seek professional help right away. Remember that mental disorders do not differ from physical disorders, that they need treatment. I hope you enjoyed this video. Thank you so much for watching. Please like, share, and subscribe if you like this video, and follow my Instagram right here. And see you in the next video.